If you are someone who enjoys hiking or mountain climbing, or if you're someone who is considering going mountain climbing, then you need to watch this video. You need to be aware of something called high altitude cerebral edema and also high altitude pulmonary edema. This is typically called altitude sickness, or people becoming sick or unwell when they rapidly go to high altitudes. So if you're going mountain climbing, you need to be aware that it's advised generally that you should not climb too fast. You should take it easy. Don't try to get to the tip or to the peak of the mountain within 24 hours, depending on how high the mountain is actually. People who ascend too rapidly, especially when they get to maybe about 2,500 meters, which is about 8,000 feet, high, might begin to experience some very really funny and distressing symptoms. So when people generally ascend very rapidly, you go to areas of the atmosphere where there's generally less amount of oxygen, less oxygen pressure. And what happens is that your body begins to struggle. Your body senses that the oxygen level has dropped. Your blood vessels begin to undergo some changes, trying to see how well they can get as much oxygen as possible. Now that can lead to swelling of the blood vessels, in your body generally, blood vessels in your brain, blood vessels in your lungs. Now the blood vessels might start leaking. So you begin to have fluids building up in your brain, and your brain might swell. You might begin to have fluid building up in your lungs, which we call medically pulmonary edema. And that might cause, if it's in the lungs, that might cause shortness of breath. You might start struggling to breathe. You might develop some chest pain, but usually it's more shortness of breath and anxiety, feeling really anxious. If the swelling happens in your brain, then the person might experience severe headaches, dizziness. You might start feeling nauseous, or you might actually start vomiting, depending on if you're, how well or how much your brain swells. So this is something people need to be aware of. Hikers, mountain climbers, you need to be very much aware of the existence of this phenomenon, altitude sickness. Now, prevention is basically try not to ascend too rapidly. And then obviously, if you start feeling unwell, having any of these symptoms I've mentioned, what you should do is for you to actually descend. So go down by maybe 250, 500 meters. Okay, so your body can reacclimatize to the higher level of oxygen. Your body can get more oxygen, and people who are professional or frequent hikers usually would be aware of this phenomenon, because they probably might have experienced it at some point. When they rapidly ascended, they felt unwell and they had to descend a bit, catch their breath, recover. So it's usually advised, if you're going mountain climbing, you should have an oxygen cylinder. Because if you're feeling unwell, generally you might need oxygen, okay, in addition to descending. So go with an oxygen cylinder. Avoid stressing yourself out, or unnecessarily avoid drinks like alcohol that might actually make you more dehydrated. And it's always generally advised that you should stay hydrated, have some fluids, especially the mineralized water, just so that you're not sweating excessively and losing a lot of your salts, sodium chloride. So this is something I just said I should share with you, because every now and again we get really adventurous. People might want to go mountain climbing and hiking. So just be aware that you need to take it slow. Don't try to get to the peak of Mount Everest within 24 to 48 hours. You can have your fun, but try to stay safe, guys.